and I am your task force chair. We also have here our task force vice chair, Councilmember Foley, who will be facilitating part of the meeting as well. And I'd like to mention that today we also have closed captioning available. I see it working well on my screen, so hopefully it's working well on all of yours as well. It's sort of just popping up at the bottom of the screen. Appreciate that we have that availability today. And before we get started in the meeting, I would like to take a few minutes to remember people who have perished in our streets since our last task force meeting on December 10th of 2020 up until March 5th of this year. And I'm going to read out the names of the 5 road traffic victims at the end of 2020, and Councilmember Foley will read out the names of the 5 victims from the beginning of this year. So last year we had a male motorist, an unnamed male bicyclist, a male pedestrian, Peyton May Osmond, Layla Marie Limos. And now I hand it over to Councilmember Foley. Oh, Councilmember Foley, sorry, you're on mute.
Thank you. I knew I was going to do something wrong. I'm so sorry about that. Let me start again then. Alvarino Alves, Jose Gastelum, William Santillana, male motorist, Wrong K.
Thank you very much. I do think it's important that we identify the individuals that were actually here to try and prevent any of these further victims with this task force as we kick off each and every one of these meetings. So on September 25th of last year, we kicked off the first task force meeting to bring together stakeholders at the county, city, and community level to help guide our Vision Zero strategies to make our streets safer. Today's meeting is the 3rd meeting of the task force. In particular, the task force is intended to do the following: to provide quarterly traffic fatality and severe injury reports, quarterly traffic enforcement given to the top 5 causes of fatal and severe injuries, or KSIs, to bring together decision makers from the city and county departments to leverage resources for a shared goal of reducing traffic fatalities, and to guide implementation of the Vision Zero action plan. Today, we welcome a new department to the Vision Zero Task Force, the County Emergency Services Agency, known as EMS. It is where the county collects trauma hospital data. San Jose DOT has been working with Jackie Lowther, EMS Director Falco Schoenweiss, Specialty Programs Nurse Coordinator Ashanti Corey, and the senior epidemiologist. I'm sorry, I'm bad at pronouncing that word. And thank you all for your collaboration. The theme for today, our first task force meeting was a kickoff, and the second meeting's theme was outreach. The theme for today is data, which we analyze to give us the insights that inform the investments we make to help achieve Vision Zero. In the big picture, Vision Zero brings together crash data collected by law enforcement staff with public health data. Within the context of this task force, DOT is coordinating partners in initiatives to connect and act on these data insights. In San Jose, crash data is collected by the city police department and the county sheriff. Trauma hospital data is collected by Santa Clara County Emergency Medical Services, and the county's medical examiner coroner's office performs studies on people who have died in traffic that determine whether they were experiencing homelessness. Today, we will discuss these bigger intersectional issues: homelessness, public health, and injury prevention as they relate to our streets and public space. As we link the data and analyze it in greater detail, we will better understand of which safety projects and strategic cross-departmental initiatives are the most impactful at reducing crashes, severe and fatal injuries, and to inform enforcement, engagement, and education efforts. Safety impacts must be regularly studied through data analytics. And as part of the task force, San Jose Department of Transportation has proactively reached out to the Valley Transportation Authority, the Police Department, Santa Clara County Medical Examiner Coroner's Office, and the Santa Clara County Emergency Medical Services Agency to coordinate on data sharing and analytical methodologies. Today, we will hear from 3 of these 4 partners: the San Jose Police Department, Santa Clara County Medical Examiner Coroner's Office, and the Santa Clara County Emergency Medical Services Agency. And throughout today's meeting, I encourage you all to think about collaboration opportunities. There will be a task force member discussion twice, 15 minutes after reports and updates, where we will hear about the 2020 traffic fatality data, and another 15 minutes after the data presentations that will be followed by an open forum for the public to comment at the end of the meeting. And now, after that intro, I would like to do a roll call of our members from the task force that are present. I'll be calling out the department or organization name, and if the representative could identify themselves by their name and their title, that would be appreciated. And we'll go forward. So we'll start off with our City of San Jose Department of Transportation. We have John Risto.
Thank you, Chair Prowls. I'm John Risto, Director of Transportation.
Thank you. And our City of San Jose Police Department.
Good morning, Sergeant Greg Connolly of the Traffic Unit.
Welcome. And our City of San Jose Fire Department.
Good morning, Robert Sapien. Thank you.
Good morning, thank you. And our City of San Jose Public Works.
Michelle, you unmute.
We have Michelle Kimball from our City of San Jose Public Works. We'll move forward. And instead of City of San Jose Parks Department.
Good morning, everyone. Neil Ruffino, Assistant Director, Parks, Recreation, Neighborhood Services.
Thank you. And I don't believe we have anybody today from our City of San Jose Economic Development. And our City of San Jose Planning Department as well, not today, but we do have somebody from our City of San Jose Housing Department.
Good morning, Reagan Henninger, Deputy Director of the Housing Department.
And Valley Transportation Authority.
Good morning, Angelique Gaeta, Chief of System Safety and Security.
Welcome, thank you. And our County Roads and Airports.
Good morning, Harry Freitas here, County Roads and Airports. I believe we also have Ellen Talbo on the line, our transportation planner.
Great, thank you, welcome. And County Public Health. Don't believe we got an RSVP for today, so we'll pass. And our County Emergency Medical Services.
Good morning, this is Jackie Lowther with the EMS Director for the Santa Clara County, and my team is here as well, Falco Shenevise and Ashanti Corey.
Thank you, welcome, and thank you for the proper pronunciation of Falco's last name. And our County Medical Examiner Coroner.
Good morning, everyone. Dr. Jordan, Chief Medical Examiner for Santa Clara County. And I believe I also have my administrator on the line. Josefina, if you're on the line, could you introduce yourself?
Yes, hi, good morning, everyone. This is Josefina Covarrubias from the Medical Examiner Coroner's Office.
Welcome, thank you. And our County Office of Education.
Good morning, everyone. I'm Dr. Mary Ann Dewan, County Superintendent of Schools.
Welcome, thank you. And Cal Walks.
Good morning, Nikita Sinha, Walk San Jose Program Manager.
Good morning. And Silicon Valley Bike Coalition.
Good morning, John Cordes for the Bicycle Coalition.
Welcome. And then AARP.
Fred Buzo for AARP.
All right, welcome. Thank you. Thank you all for joining us this morning. Okay, and now we are going to post our minutes from our December 10th meeting. And they've been posted on the website as well. And if you have any comments or feedback on the minutes, you can reach out directly to staff on that. Okay, just a little bit of housekeeping. So as you're seeing, and as we have been doing, this meeting is being recorded and it will be posted. We're We have our panelists muted by default. Since we are a large group, we do ask that you use the raise hand function in your toolbar in order to be called in and participate, and then utilize the mute and the unmute accordingly. And if you could also rename yourself and your agency names included as well. And attendees will have an opportunity to publicly comment on the open forum. This is due to the large number of panelists and a limited amount of time that we have for today. And speaking time will be limited. We do our very best to stay within the prescribed times of our agenda so that everybody can participate. An open forum at the end of the meeting, or open forum will be at the end of the meeting. And if you intend to speak during today's open forum, please raise your hand or press the *9 if you're calling on our phone. And if you'd like to do that now, that way we can get a sense of how many people would like to participate in open forum, and you'll just be in the queue. Okay, thank you. And now we'll move on through our agenda here. And for agenda item number 2 is our reports and updates. And Jesse Mintz-Roth from our Department of Transportation will give us some updates on the Vision Zero key metrics, updates on the Vision Zero action plan, priority action areas will follow, and presented by Jesse Mintz-Roth, as well as Sergeant Greg Connolly from the San Jose Police Department. And for our task force members, please feel free to ask questions during the presentation after each item.
Thank you for the introduction, Council Member. I'm Jesse Mintz-Roth, Vision Zero Program Manager at the Department of Transportation. Thank you everyone for joining today. I will begin this presentation by talking about our 2020 Vision Zero traffic fatality and severe injury and all injury data. I want to begin by thanking Councilmember Perales for his introduction that talks about people by their name. When we talk about the data here, we are not really able to do that. There are a lot of privacy concerns in talking about individual cases, and so we also want to acknowledge that we're talking about our neighbors. So when we talk about the data here, we don't intend for it to be as impersonal as it may sound in this summary way. Also, in 2020, I think as everyone is aware, everything is different, and so too is our traffic data. And so as an introduction to describing it, I just want to say that similar to reports in other US cities, the traffic volumes are down, crashes and injuries are down, but speeding is way up. And you will find that as a theme in this presentation. So we use the acronym KSI sometimes. It stands for fatal and severe injuries, and fatalities, traffic fatalities, remain in range from the last 5 years, even though they are down. But as you can see here, that fatalities caused by speeding are up over 100%. So we created these new slides to track the change in the way that 2020 data was occurring compared to previous years. And so you can see that as these lines start in the beginning of the year before the pandemic, they are in the center of the ranges of normal for injury and for cumulative fatal and severe injuries by month. But as you hit March, the line and the dots in the top two graphs, or actually in the top left graph, goes below the range from previous years, 2015 to 2019. For cumulative fatal and severe injuries by month, however, they stay in range. And if you look at fatalities, they do as well. So in total in 2020, there were 48 fatal crashes resulting in 49 traffic fatalities. Of these, 4 of them occurred in private lots. So if you look at the trend in recent years, 49 for 2020 is a reduction from a peak last year of 60, similar peak also in 2015. But we have had numbers in the 40s before. The last recent year around this level was 2016 and 2017. If you look at traffic fatalities by street user type, You can see here that we've had a notable decrease in people hit while walking in 2020. However, people hit while walking is still the largest street user group. So it's interesting that we've mentioned before the uptick since 2017 in people hit while walking. People hit while walking are the biggest group, and they're the biggest group in the 5-year data and also in the single-year data. Motor vehicle occupants, the second largest group. People hit while cycling are relatively smaller numbers, steady at 7, similar to last year. And motorcyclists have actually taken quite a decrease in 2020, down from 5 in 2019 to 2 in 2020. If you look at the median ages of these street user types, as I previously mentioned, people hit while walking are the biggest group. In 2020, their numbers fall significantly. And I think that, you know, if we think about what we know about the pandemic, older people being at greater risk, it appears that through the pedestrian data that they stayed at home this year. And so in some ways that may be a plus that the number is down, but these numbers are just to see the trends. And we also see that in the cyclist data, but as I mentioned, that's not very many people compared to the people walking. So that number is more volatile. The motor vehicle occupant median ages is roughly in keeping with recent years. And the motorcyclist data, this is only 2 data points, is also quite volatile, but in range from recent years. One of the new areas that we want to highlight, particularly in talking about this being the data presentation, and also that we will hear from the agency that this data comes from, is homeless traffic fatalities. This uptrend also fits a greater uptrend in fatalities involving people who without housing. However, being able to track this in the context of Vision Zero is a new thing that we are really interested in and want to, you know, pay attention to, given the data analysis, if we can find a way to work on this issue. You can see here that in 2020, the number of people who were hit while experiencing homelessness are, first off, they're mostly pedestrians, but the number in 2028 is higher than any of the other years that we have on record. These are a list of the fatalities that have happened since our last task force meeting. And so you can see at the end of 2020, we have 2 starred cases. Those are both minors and they both occurred on private property. We also have in 2021, a number of speeding related crashes, and all of the drivers in those are interestingly male. So to continue on the speeding theme, we wanted to talk a little bit more about the top known factors contributing to fatal and severe injuries. Specifically, if we look at the police data to see what the known causes, that first off, when we read crash reports, there are often many causes, but the police department picks a top one. And so speeding was already the top known factor, but when we update the data for 2020, it's even more prevalent. So speeding, the number 1, is almost 3 times as large as red light running, the number 2. And so when the police department presents later, we want to be able to focus more on these 2 behaviors. Additionally, you can see that if you look at the year-by-year data for speeding as primary factor, there were 13 fatalities out of the 49 this year. That is more than double the amount that we had last year. And of course, as a percentage, that also means that we have 27% of all fatalities in 2020 caused by speeding. In these next few slides, I'll be talking about our progress on the 6 priority areas of the Vision Zero action plan. So in the first area and theme of this meeting, we want to talk about our data analytics initiatives. Primarily in this meeting, we'll be hearing from other task force members, but we did want to talk briefly about some of the ones that DOT is working on. Urban Logic is the contractor that we are working with to develop a data dashboard. The contract execution is very close, should occur in the next few weeks. And so we're hoping that we'll have them on board in time for the next task force. The Vision Zero Smart Communities project, we just began presenting on this initiative that we've been working on for a year or two now. And inside this project, which is called Intersection Safety Analytics, Verizon has posted some cameras above 3 intersections in San Jose as a pilot to look into near miss data, which is one of the data types that people are very interested in. The Department of Transportation gets approached about working on this type of project frequently by lots of technology companies. And so when we did take on one of these companies to develop this product, we were very interested to develop it in the context of knowing that people hit while walking are the biggest group of fatalities in our data set. So looking at the 3 intersections, we focused here on the one intersection that has the most traffic from people walking. And we wanted to talk a little bit about the heat map that you see on this slide. You can see this intersection of Meridian Avenue and West San Carlos is an intersection that has a pedestrian type retail on the southwest corner and a surface parking lot on the southeast corner. If you're familiar with this site, on the southeast corner, it's a Safeway parking lot with a McDonald's at the corner. And what really highlights in this image is the yellow and the red colors in the south leg. And so here we have been trying to think about how to use this data and what this data means. It shows obviously a density of data there. And you can see from the text on the slide that a lot of, if we look at the sort of itemized data from the product itself, it shows us that almost 50% of the near miss events are on the south leg, 60% involve vehicles going northbound, and 83% involve pedestrians outside the crosswalk. The circles and the pie charts tell us a little bit more about the specific movement that the driver was making at the time. But I think looking at this image, we're really interested to know what we can do with this data. And so the thing that we have done so far is that we have used this to apply to a Caltrans Sustainable Transportation Planning Grant to create a pedestrian safety themed plan for the 4 council districts that our data shows have the most fatal and severe injuries, which are districts 3, 5, 6, and 7. So we applied to this Caltrans grant program last month, and are hoping that we'll be able to hire a consultant who can help us figure out what we can do with this data to effectively make walking, safer in San Jose. Additionally, we're able to use the insight in this particular location for a West San Carlos Street project that's currently in preliminary design. The second item of the priority action plan is to form a Vision Zero task force. So obviously we're here and we're at the 3rd meeting. The theme is data. The next one will be Friday, June 4th, and the theme of that one will be outreach. And now I will hand the mic over to Sergeant Greg Connolly from the police department to talk about traffic enforcement.
Good morning, everybody. Sergeant Greg Connolly of the San Jose Police Department Traffic Enforcement Units. Glad to be here with Vision Zero. We've been working with DOT constantly since Vision Zero has started and collaborating with our information and trying to lower the fatalities in the city of San Jose. An enforcement activity update here, Q1, Q2, Q3, and Q4. You can see the volume of citations that are written only by the traffic enforcement unit. During this time, which is unusual because of COVID, you can see a drop in citations, and you can also see that we started tracking warnings. Because of the precautions of contacts, close proximity of people, until we got more information on COVID, citations dropped, warnings went up for the protection of officers. As more information came out about the virus, officers had protection gear, became more comfortable with contacts, and you could see the citations rise and warnings lower a little bit. And then also in there, we have to take into consideration less volume of vehicles on the roadway during COVID because everybody was shelter in place. And as Jesse talked about, speeding was a main factor, and it did rise. Well, with less traffic on the roadways, people have a tendency to have a free-for-all, and they go very fast because there's no traffic out there. The other thing was, not only do we do enforcement for traffic in the traffic unit, we also had to take care of special operations and events, which were marches and protests and some of the things that were happening around City Hall. And that takes away from the hours that the traffic enforcement unit can actually go out and write citations. So you see some variations there. And you can see the lower one compared to last year with Q1, Q2, Q3, and Q4 with the amount of only citations, because we did not track warnings at that in 2019. But we were trying to get a handle on what our officers are doing. Are they actually warning people? Are they stopping people? And with this data here, you also have to understand the science behind it. If an officer pulls, a traffic officer pulls somebody over and is talking to that individual, the frame of mind for the 50 or 100 people that are passing by that traffic stop, the thought is the police are citing people and they're enforcing the traffic law. So it does have a deterrence, whether it's a citation or a warning, just having the psychological effect of people seeing a person being pulled over. Project updates. We have a very old eSight system. An eSight system is basically an electronic citation system that mainly only the traffic enforcement unit used. Its properties are becoming outdated, and we are now looking for newer software programs and are in the process of purchasing, hopefully purchasing another one that can keep up with the analytics and the data that we need to report back to Vision Zero and Department of Transportation. And the top two known killed or serious injured reporting, speeding and red light running. When we send officers out to write citations, their primarily focus is what we call PCF, primary collision factor, which are moving violations, and the top two are speeding and red light running. So when we go out around the city and enforce citations or enforce moving violations, these are what the police officers are looking at. And I think that's it. Do I have another screen there, Jesse?
I think that's it. Thank you.
Yep.
The fourth area of the priority actions is to increase community outreach and engagement. We are happy to say that we just this morning posted a notice of intent to award our Vision Zero Strategic Communications RFP. So we're excited that we'll be able to bring on a firm shortly. Hopefully spring, but we look forward to working with them. Additionally, there are two new regional and county Vision Zero working groups that I'd just like to mention is very important to us to be able to achieve Vision Zero. And as we broaden knowledge of this initiative around the county and around the region in the whole Bay Area and elsewhere in the state, there'll be greater coordination between cities on initiatives and literacy about work in this area. So the Bay Area Metropolitan Transportation Commission held its first meeting for regional Vision Zero work on February 17th. And inside the county, the Santa Clara County's Traffic Safe Communities Network, which is a project of the Public Health Department, which I'm part of this TSCN steering committee and now lead the working group on Vision Zero. We had 27 people attend a kickoff meeting that was on February 26th, and everyone was from municipalities and county agencies, and in that meeting gave input on the group's work plan. So we're looking forward to the future work meetings for that. Additionally, we have been working on our daylight savings time campaign, which this year we called Look Out When It's Dark Out. This involved putting changeable message signs on the Vision Zero corridors that showed these messages, and also creating a poster board campaign that are posted on Vision Zero corridors. It was a big work to put up these signs, so thank you to those who helped us. You can also see this sign above my shoulder in my non-virtual background. It's nice to have done that campaign, and also to have coordinated with the police department on enforcement on these locations, and also to have coordinated with county roads and airports to include the 2 county expressways that are part of the Vision Zero corridors. The 5th area is quick build data-driven safety improvements. Our group that we recently started in April is doing a lot of work, and you can see an outreach poster here for Center Road, where work is underway now, as is Fruitdale, also a spring project, Story Road, a winter project, Hillsdale, a winter project, and going into the beginning of next year, Branham Lane. We also have applied for TFCA grants, Transportation Fund for Clean Air, from the county for Hillsdale, and received that, and also just are now applying for a grant for Branham Lane from that same program. The last area is to prioritize resources on high KSI corridors and districts. As you saw in the last slide, all of that work is on the high KSI corridors, but the grant application that I mentioned on the slide about the near miss technology, we want to also focus on the high KSI districts, the areas that are not on the corridors. And so the grant that we applied for with California Walks as our co-applicant is tentatively called Walk Safe San Jose, and is in districts 3, 5, 6, and 7. We received lots of letters of support for that application, and we also applied for another project on King Road, which is in districts 3, 5, 7, and 8. Additionally, we want to mention our citywide collision review project, which is underway now. In this project, we look through all of the data, crash data and other types of data in recent years to, well, actually, I should say, particularly collision data, to review locations where we can make improvements. We'd like to do at these locations holistic reviews and make safety enhancements. This is typically a multi-month, if not year-long project that involves a lot of our engineering staff. So we're excited to begin that big project now. And so I'm going to hand the mic back over to Councilmember Perales.
Thank you very much to Sergeant Connolly and Jesse for those presentations. We are now going to open it up for questions on the presentations that we've just seen. And I know I got one coming in. I don't know if, and if you wanted to raise your hand for any of the participants, we'll start with Nikita.
Thank you, Councilmember. I had two quick questions about the data. One, I recall reading about a fair number of solo vehicle crashes that led to fatalities. Is that something that has increased from past years, or is that data available?
Yes, there are a large number. Interestingly, there's a large number in 2019 as well. So the number overall, I believe, is 11 or 12, similar to last year. So I would say that yes, that is true, and yes, it's also similar to last year.
Okay, and then thank you. And then my other question was, is there age data available for not just the fatalities, but also severe injuries as well? I think it is definitely noteworthy that the median age has dropped for pedestrian fatalities, but I also want to recognize that an injury for an older adult is much more, potentially much more significant than other ages, and I want to hear if there's any data on the age range of all KSI.
That is a analysis that we can do. I think that one of the things about doing the analysis is we put together these data analysis to make this presentation, but we also have another presentation coming to the Transportation Environment Committee, and there are more analyses that we could potentially do for that presentation, which is in early May.
Thank you.
All right, thank you. And then next up is Anath Prasad.
Good morning. This question is for the San Jose Police Department. I'd like to find out what their schedule is for the software upgrade to their system, because we've been waiting to get the collision records directly into Crossroad system. We have a county-wide collision database system. Would like to get that. I think we've been waiting for upgrade to the software. I would like to know when that is scheduled so that we can plan accordingly.
Hello, the process is currently underway. The purchase order has been put in, but out of my hands because we have to deal with fiscal, budgeting, and several other constraints. I cannot give you a straight answer when we will get it, but the purchase order has been in for quite a while, and we're just waiting on purchasing and other paperwork to go through.
Thank you.
I would also add that I believe the Department of Transportation is working with I want to say the VTA work. So Lily, who is on this call, may be able to speak to this in more detail, but she has been working to get the data into Crossroads. And I believe we're waiting to hear about whether it's been ingested yet.
That's correct, Jesse. I think North staff is very familiar with that process. So we are working to get the current data into the Crossroads system, but not a direct link between police department's eSite system and Crossroads.
Thank you. And this is good information for Councilmember Foley and myself, areas where we may be able to help, especially as Sergeant Conley pointed out that it may be just stalled in the process and could be just simply a prioritization of funding of a question, but that's something where we can help to see if we can't urge along. And then maybe Sergeant Conley, you can provide us updates on this as we go through subsequent meetings. I appreciate that. Okay, and was that all for you, Anath?
Yes, thank you.
And then Angelique Gaeta.
Thank you. So I just had a question for follow-up for Jesse when you were talking about the intersection of Meridian and San Carlos, because it hadn't come up in our discussions yet, and it just kind of came to mind when you were talking about it, because I'm actually pretty familiar with that location. I visit there frequently in the middle of the night when I need medication for my kids. But one of the things that I noticed is that there is a higher number of unhoused in that area, typically younger folks. And it would be interesting to see what the numbers are for that particular group that are being struck. If there's specialized outreach, I know we've got the county on the line, and they do obviously have programs for the unhoused. And if we could explore that as potentially a special type of community outreach and education to address. Again, I don't know what the numbers are and how they might be included in the number of fatalities or pedestrians being struck, but it might be worth something to look at. Thank you.
Thank you for that comment. We will actually be talking about that in our next presentation, so maybe I'll wait to answer it until then. But thank you for the suggestion.
Okay, thank you. And I think that's it, although Anant, your hand is still up, but I believe you said you were done. So I think that's it for this section. Appreciate that. And we'll now continue our discussion about data. We'll bring back Sergeant Greg Conley from the San Jose Police Department's Traffic Enforcement Unit. We have Dr. Michelle Jordan, the Director of the County Medical Examiner Coroner's Office, and Falco Schoenweiss, and apologize again, the nurse coordination at the county's Emergency Medical Services Agency. Welcome. Each presenter here will have 5 to 10 minutes, followed by 5 minutes where Jesse will describe how the City of San Jose Vision Zero Task Force uses or plans to use their data. And then for task force members, please, if you can hold your questions to the end of all 3 of the presentations, we'll give a full 15 minutes at the end of that for dialogue.
Hello again, Sergeant Greg Connolly, the San Jose Police Department Traffic Enforcement Unit. Just to give you a breakdown of the police department in itself, how we handle crashes and citations. We have a patrol division, which is typically the officers you see in cars driving around the city. There's, at an average, they're staffed with 80 officers per shift, and we have 3 shifts. We have a day shift, a swing shift, and a midnight shift. Those are the officers that will go out and respond to crashes, collisions, fatalities, minor collisions, and they're the ones that write the reports. The traffic enforcement unit, its primarily purpose is to write traffic citations and enforce the rules of the roadway. When we get those traffic reports, which we call triple nickels, they are sent to our records division and they input them to our system. And I have 2 officers inside my office that go through every single traffic report that is given to the police department and takes data from those, and we call it a hand check. So our process is very time consuming. He has to look at every report and go through every box and capture that data. With that data, we send it over to the Department of Transportation, and we also send it to the state, which we call SWITers. DOT analyzes the data and creates maps. And they're heat source maps, kind of like what we saw in this presentation. And the hotter it is, the redder it is, the more accidents and collisions are in that area. Now, we also do that as a police department with our information. So it's not solely on the Department of Transportation. We have a crime analysis unit that takes all the calls for service that are related to traffic collisions, and we capture that data. And then they also give us heat source maps to my unit, and that's how we send out officers to areas when we deploy them to different areas of the city. And as I said before, not only is the traffic enforcement unit tasked with writing citations and enforcing the primary collision factors, we're also tasked with marches, parades, protests, and that takes away from the officer's time writing citations. Last year, I had a different number for everybody. I'm glad to say our staff is up to 11. There's 15 in the office. That's including a lieutenant and 2 sergeants. And I have 2 that work for me, which is the special events team. And then we have 11 enforcement officers on motorcycles. Now, when we write the citations or we send officers out, we work a 4-day week, 10 hours a day, and we split the officers up into 4 divisions. We have Foothill Division, Central Division, Western Division, and Southern Division. With those heat map source maps in the intersections, that's where we send the officers out to work those areas. Now, with collaboration with the Department of Transportation and Vision Zero, they have corridors that they come up with that are Vision Zero corridors. If those areas are in the same area of our heat maps, we send the officers to the Vision Zero corridors and say, work these areas and write citations there. We also work with the Department of Transportation with, we called it Fight the Spike, Know When the Darkness Is There. So when the time change came, they did their campaigns, and we saw the slides with the trailers out there giving notice, slow down. And then we saw the banners as well. What we've been doing is we've been allowing those banners and those campaigns to go, let people get the information, see the information, and then we've been sending officers out to those areas when the time change happens to enforce that. We don't want to do it all at the same time. We want to give an education process, give people a chance to slow down or follow the warnings, and then go out there and enforce them. We track our citations by an e-cite system, like I said earlier. Patrol officers that are driving around in the patrol cars in their districts, they still use paper citations, and there is no tracking of that. We just don't have enough manpower to do that, and that's why we're looking for a software program, and it's going to get thrown out to the whole police department, so we'll be able to track all the statistics of all citations and officers that are writing citations. And like I said, that is in the process, and hopefully we get that very soon. And I think I covered about everything. The enforcement, honestly, with the county expressways and other facilities, traffic officers, they work in San Jose, and it doesn't matter if it's Sheriff's Department jurisdiction, county road, they have a blanket to cite anybody for moving violations and stop people. Where that county and different districts come into play is basically on investigations, which will come down to traffic collisions. And then, is that it for me, Jesse? That's the only slide?
Yes, thanks.
All right.
So to just follow up on the way that the data then comes to the Department of Transportation, here at the Department of Transportation, we have a full-time staff who takes the reports and reads them and codes them and puts them into our database. And that database, which is a large access database hosted in Salesforce on the cloud, allows us to do the more sophisticated analyses, such as the Power BI crash map, a crash and injury map that's available to the public on vision0sj.org, and also our forthcoming data platform, which will be run by Urban Logic when they come on board. In terms of our enforcement activity work with the police department, we're able to increasingly have these types of focused enforcement on Vision Zero corridors, such as the Daylight Savings Time campaign, which last year we called Fight the Spike, and this year we called Look Out When It's Dark Out. So we're also trying to focus more on the top factors contributing to fatal and severe injuries, speeding and red light running. There are some complications now with the reporting that enforcement work back to us, because the system that's old at the police department that they're trying to replace. So now I'm going to move on to our next speaker, who is from the Chief Medical Examiner Coroner, Dr. Jordan.
Good morning, everyone. Can everyone hear me okay? Excellent. Jesse, I am just going to test my slides real quick. It doesn't look like I can advance. Hang on. That's weird.
Give it a few more ups and downs and lefts and rights. It seems to take a second. If it doesn't work, I'll advance you.
Jesse, would you mind advancing when I give you the go-ahead?
Yes.
Okay, great. Good morning, everyone. The Medical Examiner Coroner's Office would like to thank Vision Zero for inviting us here today to share our data, and we continue to look forward, continuing the collaboration with Vision Zero and our county partners and our city partners. I'm Dr. Jordan. I'm the Chief Medical Examiner for the Medical Examiner Coroner's Office. And I would like to provide you some data on our retrospective study that we performed back in 2017. And then I would like to end the presentation with data that I would like to share for 2017, 2018, 2019, and 2020. So the first thing I think we need to ask ourselves is, why did the Medical Examiner Coroner's Office perform this study? Well, back in 2016, I noticed that there was a large increase in the number of homeless deaths compared with prior years. And that observation prompted this retrospective study, which was a really in-depth analysis of all the homeless deaths that we had in Santa Clara County. So we decided to look at 5 years of data to document and verify the number of deaths that we were seeing affecting the homeless community, and determine any patterns or trends among them. Jesse, if you could advance the slide, please. So we reviewed all homeless deaths from 2011 to 2016. Each year was analyzed separately for the variables, as you can see listed here on the screen. And then the yearly data was compiled to demonstrate trends during the study period. Each case was reviewed by me as the Chief Medical Examiner, as well as our Chief Investigator and student intern. Our office tracks homeless deaths through our software program that provides a checkbox for cases involving homeless decedents after the cases are reviewed. Using the software allows us to easily compile the cases where homelessness is suspected for additional review against the definition outlined in our study, which will be the next slide. It was hoped that these data and trends will inform policy discussion and help identify service gaps for this vulnerable growing population. Next slide, please. So homelessness that we found early on is not very well defined and can be quite variable. So the Santa Clara County Medical Examiner Coroner's Office determines homelessness during the investigative process by interviewing families and friends and evaluating the circumstances surrounding the death. Therefore, a classification of homelessness will be assigned by this office if the death occurred in an environment to suggest homelessness, such as a homeless encampment, or the decedent was known to be homeless based on our interviews, and or a public records search does not identify a valid living address. So I just want to emphasize that what you have displayed on the screen is our definition of homelessness. Included in this definition are individuals living on the street, in indoor and outdoor makeshift living areas such as homeless encampments and motor vehicles, homeless shelters, motels, hotels, or any type of funded housing where the decedent was not paying rent or a current lease or not involved in a current lease. Next slide, please. So what you see depicted here is that between 2011 and 2016, there were a total of 476 homeless deaths in Santa Clara County. There were 50 homeless deaths in 2011, followed by 62 in 2012, 78 in 2013, 69 in 2014, 85 in 2015, and 132 in 2016. The number of homeless deaths increased by 164% from 2011 to 2016. The point in time homeless census and survey that was conducted in Santa Clara County back in January of 2017 found an increase in the homeless population by 13% since 2015. And this is consistent with the increase that we found in our study, therefore verifying the number of deaths that we were reporting. Next slide, please. During these 6 years of data, 83% of all homeless decedents were male, with only 17% being female. Next slide, please. Caucasian was the most widely represented ethnic group at 58%, followed by Hispanic, and is representative of the ethnic demographics that we have in our county. Next slide, please. The average ages at death were compiled for each year, as you can see here on the slide, and demonstrate a trend towards an older average age. There were also 2 fetal demises born to homeless mothers during this time period of review. Next slide, please, Jesse. The location of death. So the purpose of determining location of death is to provide the number of individuals dying in places where they lived and where personal belongings were found, such as homeless encampments and motor vehicles, versus those dying in hospitals and care facilities, as depicted in the middle of this particular graph. The most common locations of death in this study were hospitals, emergency rooms, and nursing facilities where the decedent was transported and pronounced, followed by outdoor areas where the decedent was either living or were found deceased. What I'd like to draw your attention to is the second and third bar graphs on the left, which represent homeless individuals who are dying outdoors, either in homeless encampments or other places. And when you add these 2 bars together, they exceed the number of deaths that are occurring in hospitals. Next slide, please. There is a growing concern about the rise in the number of senior age homeless individuals, as depicted in this graph. Santa Clara County observed a 320% increase in the number of homeless decedents aged 65 years and older between 2011 and 2016. And this is a continued concern for us at the medical examiner's office, because as the baby boomer population ages, so does the homeless population, accounting for the increase seen in our study. Next slide, please. As many of you are aware, the medical examiner assigns manner of death, and there's 5 manners of death. There's natural, accident, undetermined, suicide, and homicide. As you can see here in our study on homeless individuals, the predominant manners of death were natural and accidental, underscoring the chronic health conditions and alcohol and drug abuse issues faced by this population. Natural deaths were the most common and include causes such as chronic alcohol and drug use, cardiovascular disease, complications of diabetes, and community-acquired illnesses. Next slide, please. As demonstrated in this graph, there was an equal distribution of deaths in each season of the year, and we attributed this to be explained by the temperate weather in the Bay Area and the overall safety of this area compared to other locations in the state and country. Next slide, please. As part of our study, we also did a focus on vehicle accidents. Between 2015 and 2016, as depicted in the graph, the number of vehicle accidents as cause of death increased by 44.4% according to our calculations. These were predominantly pedestrian fatalities, with many of these deaths occurring at night, with the decedents typically wearing dark clothing and not walking within marked crosswalks. Another thing to note with our study is that the majority of the individuals involved in these accidents also tested positive for drugs and alcohol at the time of the incident. While motor vehicle fatalities account for a small number of the deaths seen in our study, it is still important for drivers to be hypervigilant towards this population. Next slide, please. And this slide just depicts that drugs and alcohol were observed in these motor vehicle fatalities. Next slide, please. The use of drugs and alcohol remained consistently high each year, and of the 476 deaths, we recorded 121 deaths that were directly attributed to drugs and/or alcohol, or a combination thereof. Many individuals were chronic alcoholics dying from complications of alcoholism and combined drugs and alcohol. The most commonly found drugs at toxicology, as depicted in this graph, were alcohol and methamphetamine, which coincides with the drug of choice for Northern California in general, and that's referring to the methamphetamine. Next slide, please. We also looked at mental illness, and we found that the number of decedents with a mental illness was listed as a significant part of their medical history remained relatively constant. However, the most common types of illnesses varied by the year. These illnesses range from bipolar disorder, schizophrenia, and depression. Mental illness was captured more frequently starting in 2016. Next slide, please. For the study, we also looked at any type of recent stressors prior to death. So of the 476 case files that were reviewed for any stressors that occurred hours to days prior to death, we thought that this was important to take a look at. These events were categorized based on notations in our investigative reports and included emotional stressors, which are indicated in the blue, medical stressors indicated in purple, physical and verbal altercations prior to death indicated in green, and interactions with law enforcement indicated in black. The most common type of stressor was medical, indicating that a portion of the homeless decedents have underlying medical conditions and may or may not be receiving consistent medical attention. It is worth mentioning that the homeless population encountered less stressors overall in Santa Clara County in 2016 than any other year. Next slide, please. So the highlights in our study were that we documented homeless deaths in Santa Clara County increased 164% over a 6-year period. Between 2011 and 2016, the homeless population rose, with the greatest number of deaths occurring in 2016. Males and Caucasians were the most predominantly represented. Alcohol and methamphetamine were the most commonly abused drugs. Heroin deaths are being monitored and continue to be monitored given the opioid epidemic. The number of deaths of individuals 65 years and older has risen and is expected to rise given the aging baby boomer population. A significant percentage of the homeless are continuing to die in homeless encampments and on the streets. Next slide, please. Our recommendations in our 2017 report included access to consistent medical and mental health care services, as well as drug and alcohol services and employment resources, which were underscored in our report. We also felt it was important that the homeless population had consistent access to drug and alcohol intervention services. We also advocated for the use of Narcan, which should be considered in this population, particularly if homeless individuals are using opioids. We also felt that preventive health care in the forms of vaccine should be underscored. And I think given the COVID-19 pandemic, even more so underscored. It's important that homeless individuals do have access to medical care to treat chronic medical conditions. And in our report, we also stated the fact that we need to be cognizant that homeless individuals do have pets. These offer emotional support to many individuals, as well as transgender and LGBTQ issues that may affect this population. Next slide, please. As part of the summary, I also would like to share updated numbers compiled by our office. And what I'd like to draw your attention to is starting in 2017, you can see that the number of homeless individuals who are dying continue to increase, with further increases observed in 2018, 2019, and 2020. At the end of 2020, the medical examiner coroner's office recorded a record high of 206 homeless individuals that have died. Next slide, please. I know this is a busy slide, but what I'd like you to pay attention to are the accidental deaths as well as the natural deaths. As seen on the slide, the number of homeless deaths continue to rise, as we've seen. In terms of the circumstances of death, starting in 2018, the medical examiner noticed that the number of accidental deaths were surpassing the number of natural deaths compared to prior years and continues to be observed. Next slide, please. We have seen an increase in drug overdoses as well as motor vehicle collisions. What I'd like to draw your attention to are the last three categories at the end of the slide. What we've decided to do at the medical examiner's office to even provide more information for our partners is to take motor vehicle fatalities and separate them into individuals who are dying in a motor vehicle versus pedestrian versus bicyclist versus train accidents. We think this is important data that can provide further research opportunities as well as outreach to the community. So we've also seen, as I stated previously, an increase in drug overdoses as well as the motor vehicle collisions, but I think this underscores the need to approach motor vehicle fatalities with a two-prong approach. Specifically drug counseling and increased messaging around the dangers of homeless encampments in certain locations, particularly right along major corridors such as freeways and highways. Maybe the need for reflective clothing for our homeless individuals so they can be identified easier at night in the use of crosswalks. And just really underscoring the drug and alcohol related fatalities, especially if someone is intoxicated, just really underscoring the need for drivers to be hypervigilant if people are not in marked crosswalks. With that, that concludes my presentation, and I'm more than happy to take questions at the end of all the presentations. Thank you again for the opportunity. And I would like to just lastly acknowledge our public defender's office as well as our investigator in our office. Thank you.
Thank you, Dr. Jordan. That was great. It's also particularly to see the updated slides with updated data and also the way that your office broke them up so that we can after this meeting, have more intel about how to work on this than we had before from your earlier reports that are on your website. And also great to have everyone on the task force and who's watching be aware of the great work you do. I wanted to just talk a little bit about the way that our two offices have been working together since we learned about your work and reached out. We have taken the police data that we assume involves people experiencing homelessness and checked it with the medical examiner coroner's database to basically find out if the ones that look like they might be homeless in the police collected crash data do meet the county's definition of homelessness. And then we have mapped those and mapped them by whether they were hit while walking or biking or driving or were an occupant in a motor vehicle at the time. And so we find that looking at the data from 2015 to 2020, specifically within the city of San Jose, whereas the data that the medical examiner coroner presented on was countywide, specifically within the city of San Jose, most people are in this category are hit while walking. And the district with the most dots that you see on the screen is District 7, but there's also a large number in District 3 and District 5. And so when we first did this research and first began working with the medical examiner coroner, we applied for a grant to create an outreach campaign, which actually feels like it follows Angelique's comment in the last task force member segment discussion, because we're interested to find out if any other city has done this before, and also if we were going to create a campaign like this, what it would look like. And so I spoke to the lived experience board of one of the organizations here in San Jose to see if they thought this would be a good idea to pursue. And the lived experience board of formerly homeless people was supportive. We also I reached out to basically strategic communications consultants to think about how to distribute a campaign like this. And they were interested in, oh, 1 second, didn't mean to advance that slide, but they were interested in the idea of working with one of our local organizations that already works with the homeless population here in San Jose. And so last year we applied for a grant, but we did not end up receiving the grant. And so we're interested in continuing to develop this possible idea. Obviously, we realize that there are a lot of challenges in the life of someone who's homeless. So, we would like to discuss it out a little bit more in the task force member discussion that follows these presentations and also the open forum. So I'm going to move on now to Falco Schoeneweiss, who is from the Emergency Medical Services Agency.
Good morning, everybody. Falco Schoeneweiss, nurse coordinator for the specialty programs on behalf of Santa Clara County EMS Agency. Thank you for having us here. And there, okay, looks like I can advance. So here at the office, we're staff of 21. We have Jackie Lawler, EMS director, and Kenneth Miller, the EMS medical director. We have myself, the nurse coordinator. We have Shanti, the senior epidemiologist. We have a staff of 10 EMS specialists, 2 extra help, and 5 admin staff. So when I'm saying specialty programs, so we're the local EMS authority for Santa Clara County, and for the specialty programs, we have 3 trauma centers, 1 burn center, 8 STEMI receiving centers that would be where a patient would be treated, or these are centers that are specialized to treating heart attacks, 10 primary stroke centers, 4 comprehensive stroke centers, and at this point in time, an unknown amount of pediatric receiving centers, because we're currently in the process of establishing EMS for children. So this is soon to come. Couple of data systems that we use. This is only a snapshot of them. I kind of try to list the most important ones. So we have a computer-aided dispatch system that kind of tells us what apparatus is dispatched to what location, what is the arrival time on scene, when they leave the scene, when they kind of are en route to the hospital, when they arrive at the hospital. We have the system that's called EM Resource that tells us hospital status. They're open to receive 911 ambulances. They're open for trauma. They're open to receive STEMI patients, a patient that experienced a heart attack, or they're open to receive a stroke patient. An example would be, so in the treatment of a stroke patient, a CT scanner is very important. If that CT scanner would be what we call down, inoperable at the time, that center would have to put themselves on what we call bypass, so that an ambulance would not bring a stroke patient to that facility because they could not treat that patient appropriately, and they would go to the next closest center that is open. That's the purpose of that system. We have the EMS patient care record, what we use the acronym PCR, and that's our current system is Image Trend Elite. This is where the ambulance crews put all their demographic data in, and also kind of what they did for the patient, vital signs, how they treated the patient, and to what destination the patient went, and a brief narrative of the events that transpired. We then also have specialized registries where data is housed. We have a trauma registry. Our current product is Trauma Base. We have a STEMI registry. Current product is Image Trend. And then a stroke registry for currently Get With The Guidelines or Quintiles. So a lot of data housing. Focusing on just the trauma centers, just to kind of not overcomplicate it. There's a lot of acronyms and everything. I apologize. So in Santa Clara County, we have 3 trauma centers. We have Regional Medical Center of San Jose, which is a level 2 adult trauma center. We have Stanford Healthcare, level 1 adult, level 1 pediatric trauma center, and we have Santa Clara Valley Medical Center, which is the level 1 adult and level 2 pediatric center. That puts us very fortunate because we kind of divided the county into catchment areas. And in the upper left, we have Stanford, and then Valley Medical Center and Regional kind of in the center. And the purpose of that is to ensure shortest transport times possible. So I want to talk a little bit about the flow of trauma data. So a traumatic injury occurs, EMS arrives on scene. They need to make a decision if this is a designated trauma patient. We have policy 605, which is our trauma triage policy. There's certain criteria. We have physiological criteria if the blood pressure would be very low. We have anatomical criteria if you would have a penetrating wound to the chest. We also have mechanism of injury criteria if motor vehicle collision would exceed 40 miles per hour of impact speed. These are all criteria where the patient would have to go to the closest designated trauma center. If the patient does not meet this criteria, they can go to the closest 911 receiving center. So in the case that the patient would not meet these criteria, the ambulance crew would go to the closest 911 receiving center. They still kind of write an EMS patient care record, and the flow of data in regards to trauma pretty much ends there. If that patient would meet designated trauma criteria, and the patient would go to the closest trauma center. Same process, while en route electronically on a tablet, they already start the patient care record. We kind of want them to post very often, so at least the hospital has at least the minimum data set already available, and then finish that patient care record as timely as possible after the call is concluded. Of course, patient care always comes first, but we would like them to capture a little bit data and already transmit that to the hospital. So in the trauma center, every trauma center has a trauma center registry, and they also have registrars, and they kind of take certain data elements from the patient care records that the ambulance crew wrote, and also from the hospital documentation. So there's vital signs, mode of arrival, what was injured. It goes into very great detail. It's called ICD-10 codes. Every injury is being coded, and what has been done to the patient, how has the patient been treated, and the disposition of the patient. So from that, they submit monthly to our server, the Santa Clara County Trauma Registry. And from there, so we can run reports out of this, and the trauma centers can run reports themselves as well. So an example for data is our Trauma Care System Quality Improvement Committee. So they kind of look at ideas how trauma care in the county can improve. All 3 trauma centers are standing members of this committee. Our agency is member. And so we look at acute issues in the system. We kind of monitor and come up with improvement ideas. So we kind of run data reports out of the registry, and so do the trauma centers. And then we can also report back to the trauma centers, and they might report to us. Another process and data flow is we report currently monthly to the California EMS information systems. So that's a certain data set that kind of goes to them. And from there on, it goes to a national EMS information system. One other thing we do is, so the American College of Surgeons, they have a trauma quality improvement program, and the NTDB is the National Transportation Data Bank. They also require certain data sets just to monitor the trauma quality that the centers provide. So pretty complex, and this is just a snapshot. I didn't try to overload it, just to kind of explain this. There's a lot of data flows in multiple directions, and that all applies for STEMI and for stroke in somewhat a similar way. So one thing that we discussed with Jesse in the group is kind of the injury severity. And that is pretty complex how that is done in trauma as well. So one of the first things the registrars do is what is called an abbreviated injury scale, AIS, that was created in 1969 by the Association of Advancements for Automotive Medicine. And what that score does, it looks at the type of injury, the location on the body, and assigns the severity. From 1 to 6, 1 minor, 6 maximum. Just as a reference, any score above 3, we kind of associate with increased mortality. So from that, we translate that in an ISS, an injury severity score. So what they do is they take the highest AIS severity code in each of the 3 most severely injured ISS body regions, and I'll have an example following. So the region that we're coding here is head and neck, with the spine, the face, the chest, abdomen, pelvis, extremities, and external. An example would be, so if we say head and neck was moderately injured, that gives us an AIS score of 2. That is squared, comes to a 4. The chest is seriously injured, gives us an AIS score of 3, comes squared to 9. Extremity, moderately injured, gives a score of 2. Squared comes to a 4, gives us a total of 17. Everything over 15 we consider a major trauma injury. Oh, apologize, kind of advancing a little bit. Sorry, Jesse, can you get me back on track? Somehow that advancement was not
Yes, hold on a second. I'm just going to end that control and go back here, and we seem to have turned on another version of, there we go. Okay, I'm actually going to skip this slide for the moment and go to Q&A. We might come back to this, but we want to get to Q&A from one of our persons who have to leave. So I'm going to hand it over to the council member.
Great, thank you. And who was that wanted to chime in? Was that Reagan?
Yes.
Yeah,
Yeah, go for it, Reagan.
I apologize to my fellow task force members. I have a emergency meeting with the state about our COVID-related rental assistance program. But I did, before I leave, want to just share a couple thoughts around the homeless deaths portion of our presentation. You know, I think there are some ways that we could potentially have a deeper coordination between some programs that are already existing with our Valley Homeless Healthcare providers, the city funded homeless street outreach teams. The county also has some street outreach teams that have some specialties in drug and alcohol and behavioral health. So I think we could do some coordination there and maybe have some targeted outreach and services in some of the areas that you had identified on your map. And I also think, you know, this idea of an education campaign is a good one. And I'm wondering if you had any estimates yet on what that might cost, first question. And then second question, you mentioned you applied for a grant back in 2020, which I think I had noted from maybe our first meeting as a task force together. Did they provide any feedback about why you were not funded?
Yes, the grant that we applied for is the California Office of Traffic Safety. It's a competitive grant, and they do specifically outreach around traffic injuries. And they did not fund it because of their own, they described it as a not proven countermeasure. Now, we did receive that grant, but we did not, they gave us the grants, they did not fund that specific part. So when we originally mentioned it in council, we thought we had received the funding. So we were excited, but then we learned they didn't fund that section. So I think when we had crafted it, we had thought of initially fitting that grant that it would be, you know, under $100,000. But I think that if we work with, you know, whoever we can find who would be interested to work on this effectively, that we probably could create a campaign that fits the size of the budget of the funder who we can find that would be interested. Because I think we could always start in a small geography, or, you know, and then sort of treat it as a pilot, for example.
Yeah, I love pilots and starting small and being able to be flexible and nimble. But Jesse, maybe we could talk after this meeting, but I think there's a way that we can use some existing partnerships to help in that educational campaign, and that might lower some of the costs. So maybe we could connect at another time and just talk about this idea of an educational campaign.
Great. Thank you for giving us your input before you have to go.
Thanks so much.
Yeah, thank you, Reagan. And I agree. I think we have a number of contracts, and we have people out there already engaging with our unhoused community. You know, could we potentially add this educational campaign to some of that? I think that's a good idea. So now, I just wanted to go, Falco, were you able to finish up the end of your presentation there?
Yes, sir, I was.
There is there's one more slide that I was going to give, which is the way that we are looking at using the data from the EMS agency as part of Vision Zero. So there is a model that was created in San Francisco recently where in San Francisco, their Vision Zero program, their data is whereas we do it in the Department of Transportation here, their analysis is done by their Department of Public Health. And their Department of Public Health linked the crash data from the police department in San Francisco with the trauma hospital data. Now, San Francisco, it needs to be said, is a perfect overlap city and county. And also, furthermore, they only have one trauma center. So we are really interested, and also apparently so are many other counties in the Bay Area. It came up in the new Bay Area regional group that just started on February 17th. I don't believe anyone has copied them yet, but we're very interested in possibly being the first. And so we're interested to see if we can do this, what they did. So a little bit more about their project. They found that missing from police records, but in hospital records, if you look at all injuries, 20% of pedestrian injuries were missing and 25% of cyclist injuries were missing. If you look at severe injuries, 24% of pedestrian injuries, 39% of cyclists, 28% of motor vehicle occupants. So why is this important? People are always concerned that the data that we have is not showing crashes that they feel that they know happened. And so in San Francisco, they have found that these discrepancies were particularly strong in communities of concern, low income neighborhoods, undocumented populations. After San Francisco did this linkage, they redrew their priority corridors. I mentioned that we have 15 city priority corridors plus 2 county. So if San Jose Vision Zero and Santa Clara County EMS just began working together, we only recently discovered Falco and his colleagues, Jackie and Ashanti. And we met with them about a week ago and also met with San Francisco Vision Zero, their public health department, to find out what we needed to basically emulate them. And so we've requested their data sharing agreements, and they had to go internally inside the San Francisco government to get an okay to share them with us. So we're currently awaiting that okay so that we can see their data sharing agreements. And if that works out, we could be the first county to copy that model. And it's really a great opportunity to look at the trauma data and increase our ability to see these greater, it's an equity lens. We can see more data potentially that may not be in the crash data collected by the police department, just due to the types of basically finding what San Francisco found in their data. It could be true here. We don't know for sure. So we're excited to look into that area as a new collaboration. So I'll return the mic now to the council member.
All right, thank you. And we're going to open it up now for questions from task force members. And I do appreciate all the presentations. And it was enlightening to see that, as Falco described, the data sharing. And I was depressed when, Falco, you stated that, sorry for the background noise, when you stated that that was a sort of a shortened version for us. Certainly complicated, and I think what we're looking for is an opportunity, right, again, to even tap in more. And so another spigot of information wanting to be shared. So I can see how this is not going to be easy, but at the same time, thank you, Jesse, for highlighting how San Francisco has done that, albeit much easier, right? The overlap of the city and the county and the one hospital. But I think it can be done, and I think there's value. And as you stated from San Francisco, that actually makes logical sense, that areas of high immigrant populations, right, these communities of concern, lower income areas, a number of drivers that maybe don't have licenses, or individuals that could be undocumented that don't want to use the police to report any of these incidents, right? And so it would make sense that there's a lot of these incidents that may happen and occur, and our police department is never involved. So they don't have a report on it. There's none of that data would be there, but yet they go to the hospital, right? And then at the hospital, they're open about, yeah, I was in an accident or whatever it may be, and so it actually makes a lot of logical sense as to why they saw that disparity in San Francisco, and I think we would see the same where we would we would see the same where we would likely look at adjusting our corridors as well. So now I'll turn it over to my colleagues on the task force. So we'll go to our Vice Chair, Councilmember Foley.
Thank you, Councilmember Perales. And actually, you said everything that I was going to. I think the emulating the SF model that's already established seems like a natural direction for us to go, and would really be helpful for us to connect those who are reporting to the trauma centers but aren't, as indicated, talking to the police department about it. So what can we do to further those efforts along? Any suggestions at the council level that you need that would be helpful, Jesse?
I think that this is a long-term project, and we're excited to get it started, but that we don't yet know all of the ways in which we'll, need support from other entities in government. This is new for us. I think it's new for EMS, and so we, are looking to see what data sharing agreements exist in city government and in county government, and obviously the ones in San Francisco. So we'll have a lot of hurdles. Go ahead.
Yeah, I think I can add maybe one thought to that, to answering Councilmember Foley's question. Data has become, knowledge is power, data is key, and having the right technical resources to connect the data pieces is key. And I would say that as much as our engineers and planners attempt to make the connection, it's really necessary also to have information scientists, the IT staff that connect our systems for us. And I find that resources is a bit limited in the city at this time. But once we have our partnerships in place, and having the back-end resources here on staff would go a long ways as well.
Thank you, Lily. I appreciate that it's a long-term goal, but it seems like something we should be working forward to address, particularly our communities of concern, and how we can address inequities that may be existing in our road, in the safety, pedestrian safety of our roads. And I noted in one of your slides, Jesse, that it said that San Francisco actually changed its corridors, and that may result too from us investigating this further. So as you say, data is important, and it's knowledge is power, and it will help us be able to be more effective in keeping our streets safe for our pedestrians. So thank you for that, and thank you for the presentations on this. The other comment I wanted to make was about the unhoused population. Those numbers were really helpful. I hadn't seen the breakdown like that before, so I appreciate the analysis and the data. And one thing I took away is that some of these deaths of the unhoused are occurring in the evening while they're wearing dark clothing, crossing the streets, not in an intersection. And some of the things we could do might be outreach and education, but the other was suggested reflective clothing. So maybe there's a way that we can distribute, when we're distributing trash bags and other things to our homeless encampments and our unhoused population, to distribute reflective clothing of some sort. But I think that's worth taking a look at, because that will allow motorists who are trying to pay attention, who have someone coming across them who is in dark clothing and shocking them. And of course, death is not acceptable whether they're crossing properly or not crossing properly. So anything we can do to give the unhoused tools they need to help them be safe is a good step in the right direction. So I appreciate the reports and the information, and thank you very much. That's it for me, Chair.
Thank you very much. And just as a note on the time check, we do have 3 people from the public that I'd like to leave at least at 6 minutes at the end. So we've got about 11 minutes for our comments. So we'll go over to John Risto.
Yeah, thanks, Chair Perales. I'm really just going to do a thank you to both the EMS team at the county and the county medical examiner. This was a terrific presentation of data that we didn't have, and it was really a missing link of the stuff that we really needed to do to kind of put it into the human needs that we need to be looking at. So I echo yours and Vice Chair's comments on this as well. I want to thank Jesse for helping to pull this all together, and we look forward to a lot of collaboration with the county on this. Thank you.
Yeah, I'll echo that. I think the data and this has been a good start, but I think if we don't end up with some sort of collaborative, data sharing effort in the end, then this was just one presentation, right? And then it gets lost on us. So I agree with that. Okay, we'll go to Lauren Ledbetter.
Hi, good morning. I didn't get a chance to introduce myself in the beginning. I work for VTA in the planning department. Again, thank you for this really excellent presentation. I had a clarifying question for Dr. Jordan, and then a question about some potential data sources. So for Dr. Jordan, when you showed the slide of, I think it was the most recent data for homeless fatalities, you listed out drugs and alcohol, and then you listed out the traffic-related deaths and the train and pedestrian and vehicle. And my question was, with the drugs and alcohol, is that the cause of death, or is that any fatality that where it was involved? Are they unique lines?
Yes, Dr. Jordan, thank you for the question. No, those were unique lines. So the drug and or alcohol related deaths are a separate category versus the motor vehicle.
Okay.
I hope that answered your question.
Yes, you did. Yeah.
But in the motor vehicle fatalities, we do see a subset of those deaths in which drug and alcohol is involved, but it's not the cause of death. It's due to the injuries from the motor vehicle fatality.
Okay, that makes sense. And then my other question was, you listed trains, and I'm wondering if are some of those suicides, are some of the, well, I guess you wouldn't know, right?
No, I would know that.
You would know that? Okay.
Good. And that is something that we can provide.
All right. And I think the other interest we would have is, of those, which ones are what trains are they? BTA, Caltrain?
Yes, we can also provide that data. We would be more than happy to provide that data.
Okay. And then I had just a general larger question for all the panelists and even for everyone. In developing a safety campaign, so VTA is going to be leading a countywide safety campaign focusing on bicycle and pedestrian safety. One of the things we want to do is try to get at not necessarily the victims, not the people who are getting injured and killed, but the drivers. And I'm wondering, just in general, do folks have a sense of data sources that we might be able to look to where we can understand demographics and other characteristics of the drivers that are being involved, who are involved in these fatal and severe injuries for pedestrians and bicyclists, so that we can develop a marketing campaign that targets these specific people, if there's trends at all. I don't know.
Yes, that is in the crash data from the police department. So we are able to analyze that, and we do have basically the age range that most drivers are male, and we will use that, I think, when we bring on the strategic communications consultant. But I suspect that the consultant will ask us for a deeper dive into the data than we've currently done. And so we also, for the campaign that you're working on, can do a deeper dive, where possible.
I'm wondering if there's countywide data that tells that.
Presumably, yes, but we may have to get it from Crossroads, yes.
Okay, thank you. And was that all for you, Lauren? Great.
Yeah, that was. Thank you. Thank you.
Thank you. Okay, Anand?
Thank you, Council Member. My name is Anand Prasad. I'm the County Traffic Engineer. This data is fascinating. The presentation was excellent. So the EMS data and the hospital data are so useful for us to understand the impacts of these collisions. So I just want to share my work on, I did that about a few years ago, and also the problem with why the data doesn't connect. So hopefully, as you guys go forward, it'll be able to help. If EMS data can take the officer police citation or the police report number, if they can put that in their data, that'll help us extract that information. Due to HIPAA regulations, we're not able to get all the personally identifiable information on any of these records from hospitals or EMS. But if they could put the report number, we could get the rest of the data, and that'll help us connect the collision to the EMS and to the hospital data. And lastly, on the hospital side, we have more ped and bicycle collisions reported there, because if somebody falls while riding their bike, or like if they trip and fall on a sidewalk, police doesn't take the report on it. So that they go to the hospital to get the treatment. But when they go to the hospital for the treatment, we also checked on the medical record. Unfortunately, the hospital doesn't take the location of where this happened. For them, that's not very important. So if they can actually start taking that data in, then we can actually geocode that into our database and say, these are the locations where we're having trip and fall data. If there's a pattern, it'll help us identify where the problems are, and we'll be able to fix it. So thank you.
Thank you, Anant. Yeah, that's really helpful points that you've made there in regards to injuries, right? Trip and fall, and really where that location is never captured. And so that's extremely helpful. And I do think that would be great to try to gather that data at the hospital level, and then obviously be able to share it as well. Okay, last up, I believe we have Angelique Gaeta.
Thank you. Just very quickly, because I know you have members of the public that want to speak. I did want to say thank you to Dr. Jordan for the presentation. It was excellent and very responsive to the question that I had raised earlier. So thank you for that. Because of that, I'm wondering if we can get a copy of that presentation and all the presentations that were given today. They would be helpful in the work that we're doing at VTA as well. And that's it.
And Jesse, can you just answer that?
Yes, they're posted, and but if you don't have it, we'll send it to you again.
I believe they're open for everybody, right? As well, right?
Yep, okay. Yep. They're on vision0sj.org.
Great.
Okay, we can look there then. We just didn't get them in the email invite, but that's okay. We can look there. Thank you.
Yep.
All right, thank you. And I don't see any other hands. I'm not seeing any other physical hands too, if any of my task force members are having trouble with the function. And so now we will go to public comment, and we have 4 people that are waiting. I will turn it over to, I believe, Anna, and we will give each public speaker 2 minutes.
Thank you, Councilmember Perales. Give me a few seconds to set up my screen. Okay, with that, I would like to call on our first speaker, phone number ending 35140. You can unmute yourself.
Yeah,
Yeah, I don't, can you hear me?
Yes.
Yeah, okay. Yeah, this is going out to SJPD if Conley's still on the line. I want to let you know it's disgraceful what you guys do with giving out traffic tickets. You know the traffic court's closed. I want all the residents to know in this county that traffic court's closed, but they're handing out traffic tickets like candy. And it's unfair because denied and delayed justice is wrong. It's unconstitutional. Okay. Secondly, we have a crime wave going on, but you guys are at Bryan and Cherry hiding behind a bush on a motorcycle, blocking the sidewalk. You can't do that if you have a work truck blocking a sidewalk or a driveway when they're trying to put a roof on your house. It's illegal to do that because code enforcement seems to be coming by, or parking enforcement comes by giving tickets. You guys are worried about a flagpole that's 1 inch tall, but we got to worry about a homeless bum crossing the street who's drugged out on his cell phone, getting hit by a car. That's a problem. Well, it's not a problem where I live, but you guys seem to want to gold brick and revenue this district because you know you can get away with it because the people don't complain in this district, but I do. And you guys should be ashamed of yourselves. Everybody who's there should be ashamed of themselves. We got a crime wave going on. People smashing out your backsliding glass door, but you guys are there 8 to 5, hiding behind a bush like it's a cartoon. Conley, you should be ashamed of yourself. And I want to know how you can get away with blocking a sidewalk. Are you guys above the law? I want to know. And I want you guys to answer my questions about this. And this Vision Zero thing. Vision Zero. We're going to go back to year zero like they did in Cambodia. You guys really think that all this data analytics is going to work? You guys must have a connection to software companies for contracts or something for kickbacks. I can't prove that, but it seems like you're
okay. Thank you. Now we'll go to Molly McClug.
Molly, you can unmute yourself.
Hello, my name is Molly McLeod, and I'm a mother whose son was killed crossing the street in San Jose at the intersection of Santa Teresa and Cottle in March 2018 is when he was hit, and then he died of those injuries several months later. I want to emphasize the importance of using the Government Alliance on Race and Equity toolkits. Fortunately, Santa Clara County's Public Health Department was the leader and the first one to take those on, and I'm glad that the City of San Jose's Transportation Department is also involved in GARE and recently has a task force that really focuses on not just the data, but disaggregating it, which we've heard some of the information on, but then also there's steps for the community engagement part, and most importantly, getting to root causes. So for example, with more people who are homeless or unhoused being harmed and killed, then sanctioned encampments could get to the root cause of why are people walking along busy streets near the freeways, etc. I believe it is likely that it's an undercount in terms of those who were hit and killed because my son has an invisible disability, not readily seen, and at times has been homeless. So I don't know that he was included in either of those counts. He's also a Black man. I think that the ideas of, I think it's really important to find out what really works instead of just throwing money at possible outreach. The City of San Jose has partnered with the Behavioral Insights team before, so that it's not, you're actually finding out how efficacious is any outreaches there. Also, for people with disabilities, want to note San Francisco has an Office of Disability, and Michelle Mashburn is my friend who I'd really not like to be killed. The alfresco is an issue right now. Thanks.
Thank you, Molly. And next up will be Paul Soto.
Paul, you can unmute yourself.
Good morning. My name is Paul Soto. I'm a proud member of Councilman Perales' district. I'd like to extend my sympathies to Senora McLeod for the passing of your son. I would also like to extend to you the pride that I feel to share a city with someone like you that is as engaged as you are. I'd also like to extend my gratitude for the awesome job in terms of for Dr. Jordan, because you see this every day. You see the end sum result of poverty, generational trauma, neglect, the incompetencies and the unwillingness of this city to really address what has happened historically over decades in this city. We're seeing the manifestations in here, and Jesse is not going to see it on a data point. It's just not going to happen. We have to humanize it. I would challenge the fact that data is not knowledge. Data is information. Knowledge comes from a human being through experience. All data is information on a screen. Knowledge comes from a human being. He is intrinsically connected to a spiritual element that exists in the universe. So that I'd like to make very, very clear, because we need to start humanizing these issues. I am one of this population. Every single subcategory that you described, I'm a member of right now. I'm a bike rider, I'm a Chicano, I'm homeless, I'm penniless, I've lived in generational poverty, I've been institutionalized, I've been in the tents, I've been in the psych wards, I've been in your recovery houses. Okay, so we really need to start having a conversation. The reason why a person doesn't wear a vest and the reason why he wears dirty clothes, I can tell you, because dirt shows up on your clothing and you don't want to be shamed and embarrassed and draw attention to yourself. That's why we won't wear reflective clothing, because it draws attention to our shame.
Thank you, Paul. And our last speaker will be Blair Beekman.
Blair, if you can unmute yourself.
Hi, can you hear me?
Yes.
Thank you. There's a massive push by the federal government to place new 4 and 5G technology in local neighborhoods, along with a new smart streetlight system being placed around the entire city of San Jose. As this can include much surveillance and data collection, I'm hoping this can satisfy many new Vision Zero and neighborhood safety demands. For as much as I respect, this can be a beginning time of better human rights and equity practices in how to gather statistics for KSI studies and reports in San Jose, and to thank you for the very clear good news starting point in reporting today. A reminder that current new and improved KSI statistical data gathering can simply enlarge and skew the traffic death statistics of previous years in San Jose. I hope we can leave an urgency to inflate the meanings of these new data gathering practices of KSI statistics. I ask you please make honest efforts to make more open and clear with the everyday public the differences between past and present uses of KSI statistical numbers, and until new statistical data collection ideas can acclimate, be better understood, and better accepted in the next few years. A reminder, I am part of the efforts of open public policy ideas. Excuse me for a second here. With open public policy ideas for the future and accountability for the future of community surveillance technology. It is this work of more open, trusted dialogue and more open public policy talk between all parts of a community that can lead to ideas of peace and more genuine positive ideas of community sustainability. I feel a better acceptance and effort with accountability and public policies with the needs of a Vision Zero neighborhood safety plan can be an important part of how all boats can rise together at this time, and where community projects, concepts, thoughts, and ideas do not have to be isolated or work in mutually exclusive terms. To close, please keep in mind better Vision Zero.
Thank you, Blair. Appreciate we're just over time, and so I want to thank everybody for being here with us today and engaging in the discussion to make our streets safer. As we go forward with the task force, we will continue to encourage participation from all of our task force members. And our next topic on Friday, June 4th from 9 to 11 will be under the theme of outreach. And our Vision Zero task force staff will reach out to the organizations about the government staff level outreach working group meeting, which will take place next month in April. And the next Vision Zero update at the San Jose City Council will be on May 3rd at our Transportation and Environment Committee. And after today, everybody will be given a short survey following the meeting. If you can please kindly fill that out. Once again, be safe and have a good weekend. The meeting is adjourned.